Welcome to Center for Diabetes. My name is Charlotte Glümer. I'm a medical doctor, PhD professor and director of this center. In Copenhagen city there lives 600,000 people. Of those, 5.1% have diabetes, which corresponds to 20 to 25,000 people. We also know that 10 to 20% are at risk of having diabetes, and of those with diabetes, 50% do not reach their treatment target goals due to the clinical guidelines. The people that are not reaching these treatment target goals are often men that are older than 45 years old, they are shortly educated, unemployed and live alone. And diabetes is often number 10 on their problem list. And therefore the politicians in 2016 decided to make an action plan on type 2 diabetes prevention and rehabilitation. The vision of this action plan is that the Copenhagen city is going to be a beacon in diabetes prevention and rehabilitation. There are three major topics in this action plan. Number one is to decrease the social inequality in health in diabetes and the consequences of diabetes, and to establish the Center for Diabetes, and thirdly to develop new innovative solutions as digital solutions or organizational solutions. To tackle the social inequality in health, the city has worked on urban spaces. They wanted to make the healthy choice the easiest choice. Therefore, we have invested heavily in our infrastructure, making Copenhagen one of the most cycling-friendly cities in the world. We also focus on designing public parks and squares in a way that invites to physical activity and meditation. In Center for Diabetes, we focus on diabetes management. The citizens can be referred by the GPs or the hospitals, or they can come into our center by themselves. We are among 50 employees. We're covering healthcare professionals as nurses, trainers, dietitians, and have academic staffs that are developing new initiatives in the center. Furthermore, we have partnerships with the diabetes associations and research centers as Steno Diabetes Center Copenhagen. Collaboration across centers are person-centered care in action. And we have a collaboration between municipality, GPs and hospitals. We are working on having shared common goals and have patient conferences every week. Every year 1,200 people are coming into our center. They are mainly newly diagnosed, but they can also have had diabetes for several years, but without severe complications. They have different ethnic backgrounds, and 35% of the people are of non-Western ethnic background. They have short educations and often unemployed. In the center we work with 4 principles. We are person-centered and differentiated, which means that we are taking into account the individual's needs, motivations and preferences, and we do not have one package but different packages. Furthermore, we work on lasting lifestyle changes and working on active user involvement, and finally we worked evidence, knowledge or practice-based. In the center we have different services. The main services are patient education, training and diet and cooking sessions. In the patient education we focus on the life with the diabetes, medical treatment and complications. We also focus on diet, where we have focused on carbohydrate and alcohol, and we have a session where we focus on physical training and physical behavior in daily life. In the training session, we have training sessions indoor or outdoor, and here we are really working on active living in the city using the parks and the squares. We do have fitness and ball games and interval walking in the parks. Here we also work on socializing relations and networking, and facilitate that the citizens are training after they are finished their education in the center. In the cooking sessions, we are focusing on supervised cooking, learning them practical skills and healthier choices. You can also have individual sessions with the dietitians. We have services in daytime and nighttime, and we have services in different languages as Danish, Urdu, Arabic and Turkish. To meet the needs of the patients, we have different initiatives for different groups. For example, we are going to the deprived areas and have patient education and training there. And furthermore, we have a mentoring program and digital solutions for the people that have a lot of resources. This is, for example, virtual education and virtual training. You can ask yourself, does these initiatives work? The number of people that are coming into our center has increased from 2016 to 2019 from 800 to 1100 people. Here in 2020 we have a decrease due to Corona. And therefore we have made an effect survey where we have sent out questionnaires on quality of life, mental health, lifestyle and live with diabetes. Furthermore, we have made objective measures as HbA1c, BMI, blood pressure and lipids. This kind of effect are seldom measured and they are really successful. So we have seen an increase in certainty of living their life with diabetes. We have seen a decrease in diabetes stress and we have seen a decrease in BMI and HbA1c. For example, we have seen a decrease in HbA1c on 6.1 millimolar per mole, which is seldom seen in these kind of initiatives. We have also asked the citizens about the values of having these kind of initiatives in the center. After they have completed their courses, 90% said that they have reached their goals. Furthermore, they said that they have good relationships and communications with their healthcare professionals. Thank you for your attention. If you need more information, you're welcome to mail me.